infections to strep throat to sleep apnea, ear, nose, and throat disorders are something that may need more specialized care. That's where ENTs come into play, and Adventist Health Castle has you covered.
The reasons that someone would come to visit an ENT doctor would vary with the age of the patient. In general, the conditions we treat are more chronic and long-standing. So in most cases, these patients have been cared for by their primary care doctor for weeks or even months, and then they refer them to us for further care. Most children come in because of ear infections or problems with their tonsils or adenoids. Adults, it may be more commonly a sinus problem or problem with hoarseness or nosebleeds. Some of the problems that we do see would require more specialized examination. For example, hoarseness or chronic throat pain, where we might look at your throat with a scope. It's a very small scope, goes in through the nose, and we can look at the vocal cords and do it quite painlessly. And so some of those examinations are more specialized. But other than that, I don't think there's anything that we do that other specialists or other primary care doctors might be doing. There are 2 or 3 things that I can think of that people would ignore too long, and one of those would be hoarseness. The reason for that is a lot of people think, oh, I just have laryngitis and that will clear up. And after 3 or 4 weeks it's not better. That should be evaluated further. Some of those people do turn out to have a laryngeal cancer. Another issue people will often neglect to have checked out is a lump in their neck. And a lot of times people will notice there's a lump there, they don't think much of it until maybe it starts to grow or has been there for longer than it should have been. So I think an unexplained mass in the neck should be evaluated within a month or 2, not a year or 2. Hawaii has some special issues that would bring up the fog and then just the pollen, the year-round humidity, which brings a lot of mold into the picture too. And so sinus problems are very common here. Only if they've had multiple infections in 1 year, or if they have an infection that just doesn't clear up with what would normally be a treatment that would clear that infection. Not every person who has hearing loss needs a hearing aid, and some of the problems they might have that would cause their hearing loss are reversible. It might be a problem with their eustachian tube or fluid in the ear, and those problems can be treated with things other than a hearing aid. People should see an ENT doctor when they're concerned about their hearing. In my office, we do take walk-ins or same-day appointments, and if someone is interested in seeing me, they would call the hospital directly, or they could go to my website at coleout.ent.com.
This segment is sponsored by Adventist Health Castle.
Catch all of our segments and more at HiNowDaily.com.